So Dr. Anil will be the last presenter for this session.
Good morning, everybody. My topic of presentation is analysis of corneal recipients from a startup EyeBank in Eastern India. I have no financial interest. So corneal blindness is a significant global health issue with a notable prevalence of about 8.2% in India, according to RAB. It represents a major cause of blindness, especially in developing countries, driven by trauma and infectious keratitis. Our aim of study is to analyze the profile of corneal recipients in a newly established government-level EyeBank at district level in Eastern India, focusing on recipient demographics, indications, types of keratoplasty, graft details, and post-surgery outcomes. This research aims to fill up a gap in our understanding of EyeBank contributions in regions with high corneal blindness rates, highlighting challenges in EyeBanking. This is our retrospective observational study conducted at a newly established EyeBank at outreach level in West Bengal, focusing on corneal transplant recipients from April 2022 to December 2023. We have data was systematically collected from the EyeBank's medical records, pre-operative and post-operative, including demographics, keratoplasty types, graft size. We have studied the 160 corneal recipient from the very onset. The age group, within age group 14 to 92 years, 58% of the recipients were male, while 42% were female. Most of the majority of the indications include corneal scar, adrenal leukemia, refractory keratitis, or corneal ulcer with or without perforation. Failed graft contributing about to 23%. Mostly we have done penetrating method of keratoplasty. Only in few cases we have done DALK. So regarding the outcome, we have found better results in DALK group. Obviously, in optical penetrating keratoplasty, it is about 64%, while it is in 52% in therapeutic group and 58% in tectonic group. Poor results were found in 14% of the DALK, 12% of the tectonic PKP, 20% of the therapeutic, and 10% of the optical group. These are some of the pre-operative and post-operative pictures: immediate, post-operative, late post-operative. So the neglect in health seeking and high rates of infection and trauma in this region increase the demand for EyeBanking and keratoplasty. The majority of cases include leukemia, corneal scarring, and ulcers. Unlike Western countries, prevalence of pseudophakic and aphakic bullous keratopathy is less in this area. Graft failure and the need for regrafts are significant, often due to initial use of poor quality donor corneas for therapeutic and tectonic purposes. Penetrating keratoplasty is the predominant procedure performed in about 96% of the cases, with a preference for larger donor grafts due to the nature of the pathologies treated. Our limitations: the retrospective nature of the study limits the ability to establish causality and may introduce bias in data collection and analysis. Moreover, reliance on medical records for data collection could affect the study's comprehensiveness. Future studies should focus on prospective data collection, broader demographic analysis, and long-term outcomes of the corneal transplantation to build upon the findings of this study in this part of the country. These are our references.